Stop what you are doing for a moment, because what I am about to tell you in the next few minutes could truly protect your life or the life of someone you care about. There is a virus moving quietly across parts of the United States and other places in the world right now, and most people are barely hearing about it. Many clinics are not warning people enough. Many news reports mention it only briefly, yet it is still sending people, especially older adults, into intensive care with very little warning. It is called hantavirus. Today, I am going to explain what it is, how it gets into the body, what it does once it is inside, and most importantly, what adults over 60 should do this week to lower their risk. Stay with me, because this is not one of those topics you can afford to scroll past. What you hear today may change how you clean your garage, open a cabin, step into a shed, or even walk into a room that has been closed for months. And yes, the final point matters more than almost anyone realizes. Most people are still missing it. That is the dangerous part. So keep watching all the way through, because the last section may be the one that matters most for you or your family. If you have ever been near a barn, attic, basement, tool shed, storage room, garden space, or any area where mice may have been active, then this message is for you. And if you are over 60, it matters even more. Your body has less room for error now, even if you still feel strong, active, and independent. Think of your body like a city and your immune system like the security team protecting every block, every road, every doorway. Now imagine a tiny intruder that slips in so quietly you do not notice it at all. It does not crash through the front gate. It floats in through the air, reaches deep into your lungs, and starts turning your own cells against you. That is hantavirus. It is a single-stranded RNA virus, a very small but efficient virus that carries its instructions in a fragile genetic code and uses your own cells to make more copies of itself. It belongs to a virus family that has lived in rodent populations for a very long time. In North America, the main carrier is the deer mouse. The mouse usually does not look sick. That is part of the problem. It can carry the virus in its urine, droppings, and saliva without any obvious sign. Around the world, there are different hantavirus strains. In North America, the most feared form can lead to Hantavirus Pulmonary Syndrome, a severe lung disease. In parts of South America, one strain has even shown person-to-person spread in certain outbreaks. In Europe and Asia, related strains can attack the kidneys more than the lungs. The details vary, but the danger follows the same pattern. These viruses use weak points in the human body, and those weak points often grow with age. So, this is not just a science story, it is a real-world warning, and the setting can be as ordinary as a dusty shed on your own property. Now let us talk about how it spreads, because this is where many people make the mistake that puts them in danger. Most infections happen when people breathe in tiny virus particles. That is the main route. Rodents leave urine, droppings, and saliva in closed spaces such as garages, attics, cabins, barns, crawl spaces, storage sheds, and even vehicles that have been sitting unused. Over time, those materials dry out. When the area is disturbed, the virus can attach to dust and move into the air. You do not see it. You do not smell danger in time. You simply breathe it in. It can also spread when someone touches contaminated material and then touches the eyes, mouth, or nose. Bites from infected rodents are possible too, though that is less common. In older adults, this matters more than many realize because the body's first physical defenses are not as strong as they once were. The tiny hair-like system in the airways that helps trap and clear harmful particles becomes less effective with age. So what a younger person might partly clear out, an older adult may draw deeper into the lungs. And once the virus reaches those deep air sacs, the real damage can begin. This is why people sometimes say, "I only opened an old shed," or "I just swept a corner of the garage," and then weeks later, they are in a hospital bed struggling to breathe. It can begin with a moment so ordinary that it does not feel dangerous at all. That is why I need you to pay attention now, not later. One of the most frightening parts of this virus is the timeline. After exposure, symptoms may not appear right away. In fact, the incubation period can range from about 1 week to as long as 8 weeks, with many people becoming sick somewhere in the middle of that window. So a person may breathe in the virus, go on with normal life, feel perfectly fine, and have no clue that trouble's building. Then, the illness starts with symptoms that look simple, familiar, even misleading. Fever, tiredness, muscle pain, especially in the thighs, hips, and back, headache, chills, sometimes dizziness, sometimes nausea or vomiting. At this early stage, it can feel like the flu, another virus, or just a rough patch that you think will pass. But underneath that ordinary-looking beginning, the virus is multiplying in cells that line the blood vessels. That is the turning point. Those blood vessels begin to leak. And once that leak starts in the lungs, the situation can go downhill very fast. Within just a few more days, the person may move into the dangerous cardiopulmonary phase. Breathing becomes hard. Then harder. The lungs begin to fill with fluid. Oxygen levels drop. Blood pressure can fall. The heart starts struggling. This is not the kind of illness that usually creeps forward slowly for weeks while you calmly watch it. It can shift from, I feel sick, to, I cannot breathe, in a shockingly short time. And when that change comes, it can happen in 24 to 48 hours. That is why fast recognition matters so much. Let me make that progression clear, because this is the part people need to remember when panic starts. In the severe lung form, the small air spaces in the lungs begin filling with fluid because the blood vessels become too leaky. Imagine a sponge that should be light and full of air slowly becoming soaked and heavy. That is what the lungs start to become. The person may feel chest tightness, they may breathe faster, they may look anxious because the body knows something is wrong before the mind fully catches up. Soon, even sitting still may feel like work. At that point, emergency care is not optional. Many patients need intensive care. Some need mechanical ventilation. Some require very advanced life support to keep oxygen moving while the body tries to survive the storm. There is no simple pill that stops this. There's no standard antiviral treatment that doctors can hand over and send you home with. Care is mainly supportive. Oxygen, careful fluid management, intensive monitoring, machines if needed, time if the body can hold on. Patients who survive may slowly enter recovery as the lungs clear and the kidneys begin removing extra fluid. But even then, recovery can be long, weeks, sometimes months. Some survivors continue to deal with weakness, fatigue, and reduced lung function long afterward. So when I say prevention matters, I do not mean that in a casual, generic way. I mean prevention is the biggest weapon most people have. The goal is not to be brave after exposure. The goal is to avoid exposure in the first place, and to act fast if warning signs appear. This is not a made-up fear, and it is not some dramatic internet story built on nothing. Real outbreaks and real cases have been documented over the years. People have become infected after staying in rodent-infested lodging, cleaning long-closed barns, opening seasonal cabins, and handling dusty spaces where mice had been active. Some survived after long ICU stays, some did not. In one well-known outbreak tied to lodging in a national park, several visitors became infected after staying in structures where rodents had nested inside the walls. In other reported cases, adults cleaning out rural buildings without proper protection became severely ill within weeks. In South America, certain outbreaks of another hantavirus strain showed transmission moving through close human contact, which drew serious attention from health authorities. In the American Southwest and nearby regions, cases still appear from time to time, especially when rodent numbers rise and people spend more time in sheds, cabins, and outdoor buildings. The lesson is simple and sharp. Exposure does not always come from some dramatic wilderness scene. Sometimes it comes from spring cleaning. Sometimes from moving a box. Sometimes from sweeping a corner. And yes, older adults can be hit especially hard. As the immune system ages, early responses become less steady and less efficient. The lungs also have less reserve. That means the body may struggle sooner and recover slower. If you are still with me, good. Keep going, because now we get to the practical part. These are the steps that matter. Not vague advice, not fancy language, real actions. And the first one starts with something many people keep putting off until next weekend. Do not do that this time. The first thing every older adult should do is a full rodent check of any closed or semi-closed space on the property, and it should happen this week, not someday. Look at the garage, the attic, basement corners, crawl spaces, storage rooms, garden sheds, barns, old trailers, campers, and vehicles that have sat unused. You are looking for droppings, chew marks, nests made of paper or fabric, dark rub marks along walls, or that stale, musty smell that often follows rodent activity. But do not rush in carelessly. Open doors and windows first. Let the area air out for at least half an hour before you step in. Do not lean into a dark corner and inhale deeply, trying to check the smell. Stand back, move slowly. Treat the space like it could be contaminated even if the signs are small. This matters because even one mouse can create risk, and in some regions, a meaningful share of deer mice may carry the virus. Older adults should not assume that years of past cleaning without problems means they are safe now. That is false confidence. Age changes the body quietly, and the safety margin becomes smaller. If possible, do this check with another person nearby, not because you're expected to collapse, but because careful habits matter more as risk rises. People often think the dangerous part is the cleaning. Sometimes the dangerous part begins before that, with the careless first entry. So if you are thinking, I should probably inspect the shed after this. Good. Do it. But do it the smart way. And do not skip the next point because almost everyone gets the protective gear wrong. If you enter a place with signs of rodent activity, proper protection is not overreacting. It is basic sense. You need an N95 respirator, not a loose surgical mask, not a cloth face covering, and not the old shirt over the nose trick people still use when they want to feel protected without actually being protected. The mask needs a close seal so it can filter airborne particles the right way. You also need disposable gloves, preferably nitrile gloves, so contaminated material does not touch your skin and then your face. If the infestation is heavy, wear clothing you can wash right away in hot water, or use disposable outerwear if available. Ventilation is just as important. Open the space and let clean air move through before you start. This simple step lowers the amount of airborne material you may breathe. And yes, some people will hear this and think it sounds like too much for a quick trip into the garage. It is not too much when the alternative can be an ICU bed. Older adults often have less lung reserve than they think. The body may feel normal during everyday life, but when oxygen drops quickly, that hidden loss of reserve becomes painfully real. So do not treat this like a minor inconvenience. Treat it like the low-cost, high-value protection it is. A respirator and gloves are cheap. A severe lung infection is not. And what comes next may be the most important cleaning rule of all, because this is the exact moment many people accidentally create the cloud that puts the virus into the air. Listen carefully here. This one matters. Never dry sweep rodent droppings. Never vacuum them dry. Never use a blower to push debris around. Those actions can throw virus particles into the air and turn a dirty corner into a breathing hazard in seconds. Safer method is wet cleaning. Soak the area first with disinfectant. A commercial disinfectant can work, or a bleach mixture made the right way can be used on suitable surfaces. Let it sit for several minutes so the material is wet and less likely to go airborne. Then, while wearing gloves and a proper respirator, use paper towels or disposable cloths to lift and remove the damp waste. Put everything into a sealed plastic bag, then place that bag inside another sealed bag, if possible, before throwing it away in a covered trash container. Wipe down nearby surfaces as well. Hard floors can be mopped. Some soft surfaces may need steam cleaning or careful treatment, depending on the material. The key idea is simple. Wet first, remove second, and keep the particles from flying into the air. This is not a tiny technical detail. It is the whole game. A careless broom can create the exposure you were trying to avoid. So if you remember only one cleaning rule, remember this one. Do not sweep it dry. Do not vacuum it dry. Wet it first, remove it carefully, seal it up, then wash up thoroughly when you are done. If this already changed the way you plan to clean your space, that is exactly the point. Keep watching, because the next section may help someone recognize the danger early enough to get life-saving care instead of waiting too long. You also need to know the symptom pattern well enough to move fast, because the gap between early sickness and real danger can be shorter than people expect. If someone has had possible rodent exposure in the last 1 to 8 weeks and then develops fever, deep muscle aches, unusual fatigue, and rising shortness of breath, that should set off alarms immediately. Not tomorrow, not after seeing how it goes overnight, not after 2 days of home remedies. If breathing starts getting worse, especially over hours, the safest move is emergency care. And when you get there, say clearly that there may have been rodent exposure and possible hantavirus risk. Do not assume the medical team will guess it on their own. Busy emergency departments see many common respiratory illnesses, and hantavirus is easy to miss unless exposure history is spoken out loud. That one sentence could change the speed of testing, monitoring, transfer decisions, and critical support. This matters even more for older adults, because the aging body does not always send clean, dramatic warning signals early. Sometimes people feel less sick than they truly are. Sometimes they downplay symptoms because they do not want to overreact. That instinct can be dangerous here. Take breathing changes seriously. Treat them as urgent. A person can look stable and worsen very quickly. Early recognition can mean faster access to the kind of hospital support that gives patients the best chance. So memorize the pattern now before stress clouds your thinking later. Fever, muscle pain, fatigue, rodent exposure, breathing that is getting worse. That combination is not something to watch casually from the couch. That is your cue to act. And now we come to the final point, the one many people least expect to matter so much. The most powerful step many older adults can take this week is to speak directly with their primary care doctor about their personal risk before a problem happens. That may sound less dramatic than masks, bleach, or emergency rooms, but it can make a huge difference. Most older adults have never had a real conversation with their doctor about diseases that move from animals to humans, even if they live near rodent-prone spaces, spend time in rural areas, or regularly open cabins, sheds, and old buildings. But that conversation can help in several ways. A doctor can review your health conditions, your medications, your immune status, and your lung history. They can note possible exposure risk in your record. They can better understand what matters if you later show up with fever and breathing trouble. And if you already know you spend time in rodent-heavy places, that information belongs in the medical picture before an emergency starts, not after. There is no vaccine that people can simply go get for routine prevention here. There is no easy preventive medicine that makes the issue disappear. What you do have is awareness, timing, and preparation. If you tell your doctor, I spend time cleaning cabins, garages, barns, or sheds where mice may be active, that is useful. If you also explain any recent rodent signs around your property, even better. Preparation makes recognition easier later, and recognition can save time when time matters most. So yes, inspect the spaces, use the right gear, clean the right way, learn the warning signs, but also have the conversation before the season gets busy and before routine chores put you at risk. It may feel simple. It is simple. That is exactly why so many people skip it. Do not be one of them. Here is the big takeaway. You are not powerless. You are not stuck hoping this never reaches your life by chance. You now know what hantavirus is, how it spreads, what it can do to the lungs, how quickly it can become severe, and what actions reduce risk in a real and practical way. Check enclosed spaces for rodent signs. Air them out first. Wear an N95 respirator and gloves. Never dry sweep or dry vacuum droppings. Use the wet cleaning method. Learn the symptom pattern and move fast if breathing trouble starts after possible exposure. Tell the emergency team about rodent contact. Talk with your doctor before there is a crisis. Those steps are not complicated, but they are powerful. They protect your independence too. The ability to open a cabin in spring, clean out a garage, work in a shed, organize storage bins, or enjoy property you have cared for over many years. Those things matter. They are part of a full life. Protecting that life does not always require something dramatic. Sometimes it requires seeing an invisible threat clearly and taking it seriously before it takes control of the story. So if this message made you think differently about a space on your property, good. If it changed how you plan to clean this weekend, even better. And if one part surprised you, hold on to that. That is usually the part worth remembering. Share this information with someone who needs it. A spouse, a parent, a neighbor, a friend with a cabin or barn. Because sometimes the most important thing you can pass along is not panic, it is clarity. And clarity at the right moment can save a life.